I started dealing with street health in 1993. I was a snot-nosed broker at a firm called Andras.wmv, and I thought I could end homelessness by handing out sleeping bags. And I honestly did. I thought, you know, somebody's cold, they're on the street, give them a sleeping bag, they'll be warm, problem solved, I'd walk away. And street health and the workers of street health were one of the main reasons that I became an advocate. Because I realized that it wasn't enough to give out a sleeping bag. It wasn't enough to give somebody a hot meal. It wasn't enough to give somebody a shelter bed. It wasn't enough for the street nurse to patch a wound, or to treat chronic bronchitis, or to give advice on where an HIV clinic might be. That maintains something, but really it maintains them in the condition that they currently are in. It doesn't stop someone who's homeless from being homeless. That person will still be homeless with that sleeping bag, or that Band-Aid, or that meal. And that the only cure to the disease of homelessness is advocacy. Because the cure is not the agencies, it's not the sleeping bags, it's not the street nurses, it's the advocacy. Because the cure is political. Because homelessness, I believe, could be ended, but it has to be political decisions that end homelessness. Which brings me back to street health and to JICC. And if you believe that the cure to homelessness is ultimately political and that advocacy is medicine, why on earth is street health, which its reputation is based on advocacy? They are the agency that is known as the advocates of the downtown East 4 of Toronto. Why are the advocates, one after another, being pushed out? It just doesn't make sense. And why is JICC, who is the advocate, who is probably the most effective voice for the people that have no voice, is really the conscience of the downtown, who's the person that at every council meeting, at every committee meeting, at every community meeting is there representing his people. They're not the people of Scarborough, they're the people here. And he's been doing it for 20 years. And he's been doing it brilliantly. Now why on earth do you want that voice silenced? It makes no sense. And it's a huge step backwards. And you know, I just hope and I pray that there's a reconsideration here. And there's a reconsideration of the direction that street health is going. Because for street health to become nothing more than a provider of service would be a tragedy. And would really almost make street health irrelevant. Because they're not doing anything that the Urban Health Center isn't doing. They're not doing anything that St. Mike's isn't doing. What makes street health special, and what has always made street health special, is the advocacy. And please, and I know there are a couple of directors here, take it back to the board, because they're getting rid of the advocacy, you might as well be getting rid of street health.